The surgeon holds the instrument and there is the tremor and all of this, and only 2D. The robot adds a 3D visualization, very precise, with high definition, and the surgeon with the joysticks and the pedal just drives the arms of the robot, stopping any tremor. Hello everybody, I'm Dr.Marco Faria Correa, plastic surgeon, based in Singapore, originally from Brazil, and I'm here to answer anything that you ask me. I hope I can do a good job for you. Yeah, I start doing plastic surgery in the area of reconstructive and microsurgery to help people to rebuild the areas of after cancer, reattaching arms and fingers after amputation. But after that, trying to do my best in the area of cosmetic surgery, that's very popular in Brazil, I start working perfecting one technique of mini abdominoplasty, and from there I developed quite a few innovative issues, methods, technologies. Oh, of course, the so famous Brazilian butt lift. Brazilian butt lift because Brazilians are so much about the body shape, and going to the beach and exposing the body, and bikinis, the famous Brazilian bikinis, they call dental floor, and so then butt is one of the features of the female body that very appreciated by in our culture. And then the Brazilian butt lift, that very popular there, spread around the world, and bring it to plastic surgery to reduce the scar length and to make it more precise by adding some amplification of images and like that, endoscopy and robotic with the 3D and very thin and sharp tools help us to do. Robotic surgery is the state of art of minimally invasive and video surgery. Then in endoscopic, laparoscopic procedure, the surgeon holds the instrument and there is the tremor and all of this, and only 2D. The robot adds a 3D visualization, very precise, with high definition, and the surgeon with the joysticks and the pedal just drives the arms of the robot, stopping any tremor, and on top of it, sit in a very comfort position, that ergonomic, that reduce the stress and the longevity of the surgeon. We have to be always very honest, straightforward, and promising what's possible to deliver. My whole life I did like this, and being very critical about what we do and how we can perfect ourselves day after day. And then the patient really appreciate this quality of the doctor, that honest, sincere, and do what he master, delivering always good result. And plus, the cares. Brazilians and also Indonesia, we are warm people, the way we treat each other. Patients appreciate very much, because when they are in pain or with anxiety, if you have someone kind and you know, and nice, they really appreciate. Yeah, that's the goal of plastic surgery. Really, what it brings is this. There's some people think that plastic surgery is unnecessary, because just think about medicines for curing disease and pain. But people cannot evaluate the emotional pain of a woman that used to be beautiful, perfect, and after delivering the babies, have a beautiful family, but herself doesn't feel confident with that loose skin, stretch mark, and the posture and the boobs. and it rebuilds the body, consequently the self-esteem, and it's very positive for the stability of the family, because when you feel good about yourself, you not question if the other person loves you or don't love you. You are self-confident. I think more and more minimally invasive surgeries, that's been my dedication for a lifetime, because robotic is like a surgeon, like a tailor doing all the suit by hand or doing it a very high-tech suturing machine. Then it's the same about robotics. Is a tool, is an instrument that will be used in all kinds of surgery, even open surgery, not only for surgery, minimally invasive surgery, but for outside also open surgery. And I believe that more and more these minimally invasive surgeries and robotic surgery will be the new trend in plastic surgery. I practice in, my main practice is in Singapore, but I share my time in Singapore and Brazil. 3 times a year I still go to Brazil and I have my clinics in Brazil. But most of the time I'm in Singapore, in Mount Elizabeth Novena Hospital. Some patients that like to visit Brazil, to enjoy Brazil, they try to find out when I will be in Brazil, and they fly to Brazil and they enjoy our beautiful country. And then I'm there 3 times a year. I go for periods like 3 weeks, and when I'm there, I also doing Brazilian patients and international patients that fly to Brazil. It's quite easy because my email is simple. I'm a simple man. I'm Dr.Marco. Then my website is www.drmarco.com. My email, my personal email, dr for doctor, drmarco@drmarco.com. My admin for contacting and making inquiries is admin@drmarco.com. That's why people ask me, Dr. Marco, you are think of retiring, then what you plan for retiring? Say, to me, it's difficult to stop doing this because it's so rewarding. We help people to feel more confident. They are so thankful to that. They become my friends. They promote me for free, like this, you know. That it's so rewarding to see the big change that you cause in the people, in the way they appreciate my work and so on, and they're thankful. This is something really nice, they're difficult to live without this. And plastic surgery is still a handwork and is an art. Then artists cannot stop doing his art. I would like to thank you very much for this opportunity to be here with you, to share with your audience. That's my passion in life. All the best for you. Thank you so much.